Welcome to Conversations with the Winners. Today, our conversation is with Susy Molano. When it comes to healthcare interpreters, Susy is dedicated to the work of systems change. Welcome, Susy.
Thank you very much. Pleasure to be here.
So start us off with your story about how you came to this work of systems change when it comes to healthcare interpreters.
The association was born nearly 12 years ago, and one of the issues that really target the creation of the association was that we have a lot of refugees coming to Oregon. So I noticed that these families came and they didn't have enough interpreters to be able to take care of them. So for that reason, with actually some of my coworkers, we start talking about the possibility of creating an association in order to be able to help the interpreters, to train the interpreters, and also to look for more individuals that were able to attend all the needs of the refugees and the asylees and the immigrants that were coming to the hospitals. So basically, the work that we do is to grow and improve the pool of interpreters available in the regions and in Oregon. So first of all, we do outreach in the communities. We train the interpreters. Also, we provide the classes for them to be prepared to take the national test. Plus, we help them to be able to find jobs. And we are also working with the state legislation in order to provide better resources for them. And also, we want the creation of a licensing board for healthcare interpreters.
Susy, what are your thoughts about health equity and what are the issues for the community you serve?
Well, I believe that the best description of health equity is the one that is provided for the Robert Wood Johnson Foundation, and I am going to take the time to read it. Basically, is everyone has a fair and just opportunity to be as healthy as possible, regardless of their social position in the community. So language access is one of the social determinants of health. So exactly this is what we are doing, to try to break the barriers in order for the limited English proficient patients to be able to communicate with the healthcare providers and to have the best health they are able to have.
Susy, can you tell us what drives your work?
First of all, I believe that it's extremely sad for people not to be able to communicate the problems that they have, the symptoms that they have, and not to be able to understand what is the plan that the doctors have for them and what are the recommendations. And for that reason, not to be able to get better and to later on to have more pain, chronic diseases, hospitalizations, and that is not good for the communities. I want for the interpreters to be considered a very essential and important part of the medical team. And in order for the medical team to see interpreters as partners, language access partners, the interpreters, we need to raise the bar. We need to raise training, we need to raise skills. My vision is for healthcare interpreters to be able to be trained and to be supported in order for them to be the best interpreters possible. We are the voice of our patients, but we don't have a voice. This is what we are doing, having a voice.
Susy, your work involves bringing together partners to increase the quality and consistency in the field of healthcare interpreting. Tell us a little bit more about that.
Interpreters are, maybe 98% of the interpreters are independent contractors. So they don't have benefits, they don't have any type of care for them. They work with different agencies and they have to juggle in appointments and they have to go from one place to the other. So if we have clear understanding about that, we see that we need all to get together with the healthcare providers, with the agencies, with the state, with the coordinated care organizations in order to be able to really put our heads together and see how we can help each other.
I'm sure that there were many challenges along the way. Can you share some of the lessons learned with us today?
I just want for people to understand that being an interpreter is not it's a passion, it's a career, it's a mission, it's something that we do for our communities, because being an interpreter is not an easy work. You have to be very compassionate, you have to be very, sometimes to be very resilient, because you learn things that are very sad from people that are receiving diagnoses that you will never want for them to receive, for people with children with special needs, and you somehow get involved with this, with the problems and the needs and the suffering that these communities have.
Susy, thank you for your hard work and for your dedication and for helping us understand the importance of an inclusive healthcare team. And congratulations on your Robert Wood Johnson Foundation Award for Health Equity.
Thank you very much. Very appreciate it.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2020 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.